Hello friends, I am Dr. Mrinal Bhargava, DNB in Medicine, a physician in Kailash Hospital, Noida, and today I will speak to you about cold and flu. Common cold is a respiratory illness that most of us suffer many times a year. Cold and flu are caused by more than 100 varieties of viruses. Flu or influenza is generally more severe than a common cold, lasts longer and may cause hospitalization. Common cold and flu have overlapping symptoms which consist of a runny or a stuffy nose, throat pain or throat discomfort, headache, muscle pains, chills or rigors as we call them, shivering, fever or feeling feverish, and finally cough. These symptoms may last from as little as 3 days to sometimes 7 days. Some flu can get complicated and one may suffer from breathlessness and persistent dry cough that may need hospitalization. Typically, this viral infection is self-limiting and no special treatment is required, and it itself becomes alright in 7 days. However, common colds are highly contagious. Hence, we have to have our flu manners in place. So we come to the next part, that is prevention. Prevention of common cold and flu are the same as what we are doing right now for COVID-19. Flu manners could be as simple as washing our hands often, not touching our hands to our face when we are outside, wearing a mask, especially if you are not feeling well, avoiding contact with people who are suffering from a bad bout of cold. Also, we must work on our immunity. It is the people with low immunity who are at a higher risk of having complications with a common cold. These high-risk people are asthmatics, diabetics, people who are above 65 years of age, or children less than 2 years of age, those suffering from chronic illnesses like chronic liver diseases, chronic kidney diseases, cancers. These are the people who should make it a point to wear a mask in public places and keep washing their hands or using a hand sanitizer. When you are sick, try to be at home for the first 2 or 3 days so that you do not spread the infection to others. Next part is to work on our immunity. Immunity can be brought up by not just having any medicines or vitamins. It is a sum total of our daily lifestyle. Adequate sleep, adequate water intake, having good healthy food, including fruits, vegetables, a balanced diet. Maybe sometimes vitamin supplements do help in upping our immunity. Now about the vaccination. Yes, the severe flu illness can be prevented by vaccination. Vaccination is maybe 50 to 60% effective. And every year a new vaccine is released by the government because the influenza virus mutates, meaning the influenza virus changes its shape and changes its form so that the previous year's vaccine is no longer effective. And hence an influenza vaccine has to be repeated every year. Who needs the vaccination? Again, vaccination is required more by the people who have low immunity because of having chronic illnesses, which I had mentioned earlier. So they are the people who should get vaccinated so that their severity of viral illness is less and they are less likely to suffer from complications of influenza. So now I will come to the treatment part, which generally is not much, but I must tell you the warning signs which should tell you that you should meet your doctor immediately. One is high-grade fever, not relenting to medicines. Second is persistent cough. You're not able to speak a sentence or two without coughing. And thirdly is breathlessness if you're feeling out of breath by doing minimal exercise. Severe headache or vomiting, which is not coming down with medicines. These are the signs that you should meet your doctor. So friends, if you are suffering from common cold and if you have a doubt that you are suffering more than normal, you must come and meet us. We are all here to help you at Kailash Hospital and give you the right guidance of how to handle your illness. Thank you.
Subscribe subscribe now and press the bell icon. Never miss an update.